This is another topic that comes up in Instagram, and patients who come to visit me, they say, well, you know, how often do I need to change the implants, the breast implants? A lot of surgeons have been telling patients in the past that you have to change your implants every 10 years. I remember when I was a brand new plastic surgeon, everybody thought breast implants need to be changed every 10 years. As time went on, and now it's been more than 20 years I've been in private practice, I have seen all sorts of outcomes. Also, implants have really matured over the past 20 years. What we're at where we call 5th generation silicone implants. And we have gone through this whole upheaval about textured implants and potential rare lymphatic events that can happen with them, which as a result I moved away from textured implants altogether and use only smooth implants. But we have all matured. Surgeons have matured, implants have matured, and the data we have about implants has really evolved. One thing that is a must and is very important is that if you've had silicone implants, specifically silicone, because if a saline implant leaks, we know it's leaked. They deflate. And I've kind of moved away from saline implants over the years because the new 5th generation silicones are so safe and so reliable. And to be honest, I've never seen the new 5th generation implant leak with the new company that I'm using. But it's very important. 5 years after your first placement of the silicone implant, it's very important to get a magnetic resonance imaging, MRI, to evaluate the implants. And MRI is very sensitive for detecting leakage. After that, you need to be examined possibly every year or up to every 3 years. And at that point, if at a 3-year mark, if there's any questions whatsoever, another MRI is recommended. But what happens when a patient is 10 years out from their implant augmentation and they have no problems whatsoever? Would I tell them to change their implants? If the MRIs are negative, the physical examination is normal, the answer is no. I don't tell them to change the implant, because if you change the implant, there's a chance all those problems and risks renew themselves in terms of capsule formation or infection, and the chances of you having a poor outcome actually go up, not down, because you changed your implants at 10 years. So I think the general consensus is the implants need to be changed when the patient has a problem, for sure, or if the implant has a problem, we need to change the implant. Sometimes even if we go back in a year later to change something about the breasts, or maybe release a capsule, I vote for changing the implants, even if it's a year later, because I don't want to have any questions on whether that implant was safe to put back in or not. But when it comes to a patient who has no problems, 10, 11 years, I tell them, look, just come see me, we'll get an MRI. If the MRI is negative and you're totally happy, we'll watch it. But if at any point in time you're unhappy, or if there's problems, we will change the implants. That's my general position on implants.